This is ring forceps. In the forceps, this is a ring forceps and tissue holding forceps. We have some surgical instruments. This is penetrating towel clips. We have so many type of towel clip, non-penetrating also, but this one is towel clip, penetrating towel clip. We have another surgical instrument is mastoid retractor. This is also a type of self-retaining retractor for retracting the buttocks, retracting the skin, and it is mostly or mainly used in pediatric. This is C retractor. This is a type of retractor and this is called she, and you can observe this is in C shape, so you can identify. This is one another a big size mastoid retractor and self-retaining retractor mainly used in pediatric surgeries and pediatric patients. Okay, so this is another type. This one is Addison tooth forceps. You can observe this one is Addison tooth forceps. Addison and the tooth you can observe very easily. This one is Addison non-tooth forceps. This one is, I am repeating again, non-tooth, and this one is tooth forceps. You can very easily observe the tooth in the tip. Okay, these are the forceps, tooth forceps, and another one is non-tooth forceps. This is having suture cutting scissor. You can see the style and shape. Then this one is rider needle holder. This one is very finer suture and fine tip this needle holder is having. So this is called rider needle holder. We have Mayo needle holder and this one is rider needle holder for 6, 7, 8 sutures using. And this one is Mayo, which is using in 10201 number sutures we are holding in this needle holder. These are the very important image based question for NORCET examination, my dear friends. Mayo needle holder for holding the needle, and this one is very important and eligible question for NORCET 10, and this is pot scissor. Pot scissor very fine minute vessels cut करने के लिए, for cutting very fine vessels we are using in deep pot scissor. This is called pot scissor. Yes, and very important surgical instrument using in gastrosurgeries. Pot's scissor, type of fine scissors. Another one we are having Matson bum scissors. These are the Matson bum scissors. Tissue cutting scissor, fine scissor, and Matson bum scissor. You can see the fine, how much fine it is. It is using for tissue cutting, very fine tissue cutting in deeper also. Next, the surgical instrument is Mayo. I had already shown you the Mayo scissor, suture cutting scissor. This one is suture cutting. The third type of scissor is suture cutting scissors we are having. You can see and identify very closely. This one is suture cutting scissor. Another, we are having three type of scissors. We have mostly, and this one is retractor, self-retaining retractor, which is also known as Balfour retractor. We are having butterfly like structure in key is a key of this retractor. Mostly we are using it in abdominal area for retraction. This is self-retaining retractor, which is mostly and commonly used in abdominal surgeries, my dear friends. See, these is self-retaining retractors, a type of very important retractor which is self-retaining and used in the abdominal surgeries. You can very easily observe the shape of this retractor. Yes, this is used in abdominal surgeries. See, very important shape of this retractor. Another surgical instrument we are having is a, yes, see what is the shape, what is the key, How many screws are there? These are the question mark, my dear friends, and most commonly asking question in every nursing or every examination, which is called as Deaver's retractor. We have Deaver's retractor in so many sizes: middle Deaver's, large Deaver's, small Deaver's. So this one is Deaver's retractor. These all are the retractors to retract the skin, my dear friends. For retracting the skin, we have so many sizes of retractors. This one is the smallest, Harrington. H for heart, H for Harrington. This is called as Harrington and mainly used in abdominal surgeries. Very fine and very small size Deaver's retractor for retracting the abdominal cavities. This one is a small size Deaver's retractor and mostly used in pediatric surgeries also. Sometimes we are using small size of Deaver's. So these are the medium size of Deaver's, which is used in abdominal surgeries. These are called as Morrison retractors. I'm going to show you the retractors, and this one is Morrison retractor. You can easily observe this shape. This is Morrison retractors, my dear friend, to retract the abdominal cavity. This is Morrison retractors. See the shape, the tip, the handling. Next one, we are having Doyen's retractor. Ideal instrument for using in abdominal surgery and cesarean section surgeries is called Doyen retractors. Doyens, we are calling this surgical instrument is Doyen retractors. These are the Doyen retractors. Another surgical instrument, we are having the shape of Langenbach, the L-shaped retractor, Langenbach retractors. And Langenbach retractors, in some hospitals, some surgeons are used to call it right angle retractor and Langenbach retractor, L-shaped retractor. These are the three type of metallic suction tip. This one is very fine suction tip. This one is sump suction tip for sucking the fluid into the abdominal cavity. And this one is Yonker suction tip, my dear friends. This one is calling Yonker suction tip. Another one, we are having eyelid retractor and also called as vein loop. Eyelid retractor and vein loop for holding the vein, for holding the very thick duct, so we can retract. This one you all are knowing about kidney tray, my dear friends. We are having so many sizes of kidney tray. This one is some large kidney trays and bean shape, kidney tray for keeping BP handle. These are the bowel clamp. In the every surgical instrument, we are having straight instrument and curved instrument. So these are the straight bowel clamp for clamping the bowel in the abdominal surgery. And another, we are having straight one and curved one. This one are curved bowel clamp. This one are curved bowel clamp. Yes, you can see the serrations very finely or very closely. This is called as bowel clamp. And we next to the surgical instrument, we are having Siemens speculum. This is using in obstetric and gynecologic Siemens speculum. The Siemens speculum also we are having very different sizes. This one is Siemens speculum. Another one, the size of this is called as sounds, uterine sounds. Okay, these the instruments using in DNC, dilatation and curettage. This is curettage. This is valcellum. This is Alice forceps. This is ovum forceps. Yes, these instruments are using in the dilatation and curettage procedure, which is going to, this is valcellum, going to proceed in obstetric and gynecological procedures. This is sponge holder. You can see very easily this is sponge holder. We are having ovum forceps also, ovum holding forceps, and this